I'm Kevin Price. Welcome back to The Price of Business. The group's called Coalition Against Over-Medicating Our Youth, CAOOY.org. They partnered with The Price of Business in an ongoing series of programming on the business of ADHD and the price of the ADHD business, rather. And we've got our partner in that, Frank Granett. And how are you today, Frank?
I'm doing great, Kevin. How are you doing this great Monday morning?
I am doing awesome. Yeah, glad to have you. By the way, let's talk a little bit about what CAOOY does, and then also jump right into introducing our guest today.
Well, CAOOY, Kevin, it stands for Coalition Against Over-Medicating Our Youth, and we promote appropriate and comprehensive assessments before we especially put young children on powerful psychoactive medications. So across the country, educators, parents, and even our healthcare professionals out there are realizing the societal benefit when we do that and go that route. Because, you know, in business, Kevin, we have a dysfunctional assessment process, especially when it comes to kids, and basically, assessing their behavioral problems. So, with today, we're very fortunate. We have one of the top pediatricians in the Dallas area. She's from Plano, Texas, and Dr. Shridharan. She's an award-winning physician, pediatrician. She's won the Patient Choice Award in 2013. Practiced at prestigious medical centers, including Stanford, as well as the Children's Center here in Dallas. And Dr. Shridharan, great to have you on our program today.
Thank you. Thank you, Frank and Kevin, for having me.
You bet. Early on, I want to establish, is the best website for you txnaturalpediatrics.com?
That's right.
Yeah, txnaturalpediatrics.com. Go right ahead, Frank.
You know, Dr. Shridharan, in your philosophy of care, and we talked about this, in our book, in the book that I wrote, in our educational DVDs that are out there, where, especially pediatricians dealing with young kids. And you grew up in India, and as you came to the United States, how do you feel, or how did you come across going after functional or integrative type medicine? In other words, uniting traditional medicine with a little bit of natural intervention. Did you come about that on your own, or did you get here and say, what a mess we got here in America, and we need to change things fast?
That's a great question. Actually, a little bit of both, because while I was growing up, there is a lot of herbal remedies and natural remedies that we practice in India, which we don't see here. So I practice that with my kids here. And once I became a pediatrician, I started working at Children's Medical Center, many big hospitals, and I started seeing narcotics and all these strong medications being prescribed for kids with behavioral problems. But nobody was really addressing the underlying piece of main thing, which was the nutrition or any of their home environment and things like that, the supplements. So kind of a little bit of both. It kind of got me thinking, and that's when I decided to start my own practice called Natural Pediatrics, where I integrate a lot of natural remedies. I do not over-prescribe medications. I do prescribe medications when it's necessary. But I try to kind of turn to supplements and a lot of nutritional remedies.
So is your approach basically what can you do naturally first before you use anything from a pharmaceutical perspective? You try to go as long as you can and consider as many options that are natural before you go to pharmaceuticals?
Absolutely. For kids less than 6 years, I do not use any medications if possible. Of course, if it's something very serious like a bacterial infection, I will prescribe antibiotics, but I do not prescribe any symptomatic medicines. We try to do all the symptomatic stuff with natural remedies, changing the diet, because I think the nutrition is like the main factor. If you change the nutrition and the diet in a child, a lot of allergies, rashes, behavioral problems, everything can get treated.
Yeah, very good. Frank?
Dr. Shridharan, in other countries, especially in European countries, they have the recommended, for example, like in small children, the fiber intake. So, and our parents, and I'd like our listeners to understand that, we're just dealing with one segment of the problem here that could actually reverse neurobehavioral challenges like ADHD, anxiety, depression in our young kids. When we talk, do you find in your practice, doctor, that, cortisol levels in our teenage population, even in young children, the fiber content is just so low in their diet, and that helps. The fiber can actually regulate glucose. Are you finding a lot of problems across the board with, as your children come in to see you with respect to that?
Oh, absolutely. I mean, their diet is so messed up because everybody's kind of trying to get the easy method. So fast foods are like the main part of their diet, and that has no fiber at all. Doesn't have any nutrients, too. So, I mean, when we say the whiter the bread, the sooner you'll be dead, that's exactly what it means. Anything that's white, made with white flour, it doesn't have any fiber content. It has just all these free starches and carbohydrates that increase your blood sugar level that cause havoc in the brain. So you're absolutely right.
Yeah, that's interesting. So in the Dallas area, is there like a certain age group in particular? Obviously pediatrics, but are there certain ages that tend to gravitate towards you, or what are some of the characteristics of your practice?
Well, I see newborns right from birth to 18, but I do see a younger population more. I do not see a lot of, after the age of 13 and 14, I don't see them a lot. But until like 13, 14, that's when we have most of the behavioral problems and stuff. I do see a lot of kids that age.
Yeah, very good. Frank?
And Dr. Shridharan, we talk about that brain-gut connection where the stomach actually, if we have a dysfunctional stomach, if you will, where, there's not enough, probiotics going after and making sure that stomach and small intestine is functional, because that's where the precursors for our neurotransmitters are actually manufactured. What are you doing right now in your practice to get that fiber content up? Like, what are you telling the parents right now? A 1, 2, 3 step, take-home message for our parents that they could do right now nutritionally.
Well, my main research area is nutrition. So I spend a lot of time talking about nutrition at every checkup with every patient, especially with patients with behavioral problems. The way we talk about nutritional changes is to kind of start getting all the whole wheat products in their diet, change from all the white flour to whole wheat products. We incorporate probiotics in their diet, and then, of course, more organic vegetables and fruits. However closer to nature they can be, avoiding all the processed foods and artificial dyes and chemicals, that would be the best kind of diet for a child.
Yeah.
And are you finding, really quick, Kevin, are you finding that there's more diabetes incidence at a younger age? Do you find that age group coming down where you're saying, hey, we may have a pre-diabetic child here? Are you finding that more and more today versus 15 years ago when you started practice?
Oh, absolutely. I mean, we're seeing like kids as young as 12 and 13 ending up with diabetes, and the reason is the sugar. And I have given a lot of seminars about sugar, how sugar is actually poison. This is what I keep telling my patients, because it is a white poison that we feed our kids. So we have to actually look at the sugar content of everything that we buy in the store. And this is what I tell most of my patients. If there's more than 5 grams of sugar in anything you buy, that should not be fed to the child.
I got to wrap it up. Thanks so much, Frank Granett, Dr. Shridharan. I want to encourage you to check out both of those websites, CAOOY.org. That's for Frank. And then for our guests, txnaturalpediatrics.com. Thanks to both of you.
Thank you.
Thank you, Kevin.
When we come back, much more for you. I do want to remind you, best content here, including this interview, can be found at usdailyreview.com. More after this.